Hello nurses and future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I am going to share with you steps that you can follow as a student nurse to pass OSCE examination. Do not forget that whenever you're going to do OSCE, there are things that you have to put at the back of your mind so that you can do them to pass your examination successfully. So sit back and watch this video till the end. Do not forget to like, share and subscribe to my YouTube channel, Nurse Clement B, right? So thank you very much for your support. Thank you very much for your shares, your likes and watching my videos. I really appreciate that. I am not taking that for granted. Thank you very much. The first thing to do when you want to pass OSCE examination is for you to prepare. Preparation is the key, number one key to success. Moreover, whatever you are doing in this world, you have to prepare for it, right? So you have to prepare for OSCE. So what are you going to do? Of course, you have to understand the format of OSCE examination. What is the format, right? What are the stations? How many stations are involved when you are involved in the OSCE? Are there 6 stations? Are there 12 stations? Are there 10 stations? So you have to understand the format. You have to understand the stations that are involved during the examination. And then you have to understand the rotation that is being involved that can lead you to one station or the other, right? That is part of your preparation as a student nurse or as a nurse that wants to pass a particular examination, right? You just have to prepare very well. You have to read, you have to understand the format, you have to know the timing and the way of rotating from one station to the other, right? So the next thing during preparation is for you to what? Practice, practice, and practice. Of course, you know this is exams that deals with skills, right? So you cannot successfully pass OSCE examination without practicing. Some students will like, okay, let me just go during if the examination is approaching, I will just watch videos and then I will just get it. No, you have to it's an hands-on examination. It has to do with skills. So you have to practice and practice. If you have your skills demonstration room, go there, learn and learn. Learn with your peers. Get a mentor. As you practice, they correct you, right? As you practice, your peers correct you. As you practice, your mentor corrects you. Or your clinical instructor can help you do that too, right? So you can learn and learn. Let me tell you nothing but the truth. During examination, most especially when it comes to examination like OSCE, my dear, you just have to practice it. If you don't practice, you will not be able to carry out the procedure during examination. That is the truth. Remember, it's not theory that you just cram in your head and just come and start verbalizing. No, you have to know where can I place, for example, in what degree can I place IM injection? Is it 90? Is it 45? Is it 15 degrees? So you have to practice and practice it, right? Before you do that. So it is important that during your preparation, you have to practice and practice with your peers. The next step is during preparation, you have to learn how to communicate, right? Sometimes I watch students as an examiner. I watch students during examination. They are not audible. They will just be like talking and the examiner is not hearing what they are saying. This affects your scores because of course, if your examiner do not hear or she's finding it difficult to hear what you're saying, then she will score you based on what she can hear, right? So it is important that you speak audible, not shouting. I'm not saying that you should shout, but be audible, right? Be audible when you are talking during the examination, right? Communicate and avoid being loud during the OSCE, right? So learn how to communicate. Which tenses are you going to use? Is it past tense? Is it present tense? Is it continuous tense, right? So you have to learn how to do that. So now let's look at during examination. What and what are you expected to do during OSCE examination? For example, you are the next candidate that they called during OSCE examination. Of course, you will be directed to occupy certain stations, right? All the students. Then the first thing that you would do during OSCE examination, right, is understanding the instruction. Let me tell you something. Take your time. Understand the instruction during OSCE examination. Do not assume in your head that this is what, or do not create your own instruction or question in your head. No, 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 no. If the instruction says carry out birth bath on this particular patient, on the patient before you, please do not stand and explain the procedure. These are two different types of question. Carry out, perform, or demonstrate a particular procedure. Let's take, for example, birth bath. Is different from explain the procedure, birth bath procedure, to a particular set of group or your juniors. These are two different questions. Sometimes during examination, I watch my students, some make mistakes like that. Instead of carrying out a procedure, they explain the procedure. And it is boldly written on the instruction which says carry out or demonstrate birth bath procedure or perform birth bath procedure. These three instructions mean the same thing: carry out, perform, or demonstrate. Do not mistaken it to explain. I know that all examiners, even during NMCN professional examination, they always indicate that if they want you to explain or teach, you explain it. But some students, or instead of explaining the procedure, they perform it. These are two different. Please, if the question says that it says demonstrates, perform, or carry out, you will, at the end of the question, you will see report as you carry along, report as you go. So this already have shown you that you are expected to carry each step by step, not explaining. And as you are carrying out, you explain the rationale behind what you are doing. That is report as you carry along, right? So, and again, if you're asked to explain the procedure, do not mistaken it to carrying out. These are two different questions. Remember, if you do not, during examination, if you do not understand the instruction given, whatever you are doing is wrong. If your question says that carry out a certain procedure and you explain, and the checklist is for carrying out, of course you score 0. Maybe if the examiner is kind, he may decide to give you 1/20, for example. So it is important as a student to know the differences between carry out, perform, or demonstrate, between explain a particular procedure. Pay attention to details on the instruction. That is the first step for your success to pass exams. OSCE examination. That is your first step. If you do not understand the instruction pasted on the wall or placed by the procedure station, you will fail. That's the beginning of failure. But if you understand properly, it will help you to pass your exams. Let me tell you, it is important to note that you are allowed to take like 10 seconds, 30 seconds, 40 seconds just to digest the instruction, that which is being placed before you to carry out a particular procedure, right? So do not rush. Do not rush like you're trying to rush and do, because it is just oral care, you just rush and then before you know, you missed some steps. Take your time. And if you're too anxious, it's okay to be anxious during exams, but if you're too anxious, take your time again. Take a deep breath. Inhale and then exhale. You calm yourself down, then you continue immediately. While you're doing that, do not take much time, right? If the instruction said set requirements. If certain requirement is needed for the procedure, please kindly set the requirements. Kindly set the requirements before you do that, you carry out. For example, you meet maybe they set a bed and you are asked to carry out bed making. Convert this bed to a cardiac bed, right? So what you're expected to do is now to strip the bed and then set your requirements on a trolley before you start converting it to what? To a cardiac bed. If the previous candidates carry out a procedure and the requirements they are scattered, since it's OSCE, take like some few seconds, rearrange the requirements before you carry out your procedure. If not, during the procedure, you start looking maybe for a forceps, you start looking for gauze, you start looking for, just take your time and rearrange for just some few seconds, for some seconds, right? And the next thing during OSCE is for you to know how to manage your time. During your preparation, you have to practice within time frame, right? For example, now during professional examination in Nigeria, we have been given 10 minutes for each station. So during preparation, you have to learn how to practice each procedure within that minute, right? So you have to, during OSCE, you have to make sure that you carry out your procedure within the time frame. That is 10 minutes. Depending on the time that they have fixed for. Is it 5 minutes or 10 minutes? Make sure that you manage your time and carry out the procedure effectively. Hello? And again, note that you are not permitted to jump any step. Each step in OSCE is important. Do not jump a step and said, and said that this step is not important. No, no, no. Make sure that you follow each step during the procedure and carry it out. Now, after carrying out all the procedure, each steps you follow, you have carried out, and the procedure properly. Make your patient comfortable. Rearrange requirements. Remember, this is OSCE. You do not discard the requirements. You tell your examiner, I am discarding my use equipment by rearranging them because this is OSCE. Another candidate will come after me. So you discard by rearranging your requirements. After which, you remove your glove and go and perform hand hygiene. Please, go and perform hand hygiene, then come back and record. I used to tell my students, whenever you want to record, even if there is no paper there is nothing for you to record, remove pen from your pocket. If you're allowed to go in, remove pen from your pocket and imagine that you have a paper, record. I am recording. Say that I am recording so procedure. The procedure that I carry out, for example, if it is medication, I am recording this, the medication I have administered, the time, the date, and I'm signing. I signed with my initial or signature. Do not forget again, when you are carrying out this procedure, avoid saying, I will. Avoid using future tense. Use present continuous tense. I am carrying out. I am applying, I am doing this, I am doing that. Do not say, avoid the use of I will. No. Say, I am doing this. I am applying this medication and this ointment. I am applying tongue depressor. I am. Do you understand? So, and then end up properly. I hope this video is helpful, and I hope that you learned something today. As a student nurse or as a nurse trying to write or carry out any professional examination that has to do with OSCE. Thank you very much for watching. Thank you for staying with me till the end. Do not forget to like, share, and subscribe to my YouTube channel. Thank you for watching this video.